symptoms. So again, both of those together combine. So if we have, just kind of use your basic A&P skills here. If we have somebody that has a high blood pressure, they have low oxygen, they're dehydrated, they're dizzy, they're short of breath, and they're nauseated and vomiting, what could be going on there? So think about it. Dehydration is probably from the nausea and vomiting. They've been vomiting a lot. So it could be a stomach virus, and incidentally, when you're sick, sometimes that can make your blood pressure go up if you're in pain, stomach pain, or anything like that. The dizziness or short of breath, it could go along maybe with a strep infection or upper respiratory infection. So we're probably looking at some type of mild respiratory infection here, or it could be a gastrointestinal infection. So that's how the physicians get to the actual diagnosis, which is the disease. Okay, going on to the next one. Oops. Okay, objective evidence of disease. This objective evidence, again, something that we can measure. So something we can measure are lab tests. Urinalysis, we can do a urine dipstick and it'll tell us the components of the urine. We can do a blood test, blood chemistry. We can do an EKG or electrocardiography, which shows the heart waves. We can do an x-ray or radiography, so we can see if somebody has a broken bone or whatever. Then we have diagnostic imaging techniques like a computed tomography or a CAT scan, otherwise known as a CAT scan, or a CT scan. Magnetic resonance imaging, otherwise known as MRI. Ultrasound, nuclear medicine, which basically is used what the physicians do, or the radiologists will do, is they'll run dye through a vein to see how it works, basically. So nuclear medicine allows physicians to visualize function of organs. So let's say an intravenous pyelogram, IVP. You're going to have an IV, it'll have dye, it'll go in there and you can see the abdominal organs empty out, and you can see digestion occur, how the gallbladder absorbs and digests. So that's what nuclear medicine is. Going on to the next slide, it's a continuation. We have a biopsy, of course, where you can take a sample of tissue to see if a patient has a cancerous lesion. Physical examination, sometimes just doing a physical examination, listening to the heart sounds, listening to the lung sounds, all of those can tell the physician quite a bit. Medical history, when have you had this problem before? If yes, have you had surgery before? Yes or no answer. So medical history can also give a physician a better hint of what's going on. Then we have a family history. We want to know what mom has, what dad has, what grandma and grandpa have, what brother and sister have. And this, again, will add on to see if this, whatever the physician is thinking of, they may begin with 5 or 6 possible diagnoses and then dwindle down to fewer and fewer. And then we have medication history. And this is, what prescription medicines are you taking? What over-the-counter medicines are you taking? What herbal supplements are you taking? So your medication history can tell us, if it's caused by medicine, maybe you took too much of something by accident, maybe you did it on purpose. Anyway, but medication history can tell us a lot. Going on to the next slide, this again is a video on taking vital signs, so you can watch that when you can. Again, the next slide is another video on the topic of taking patient history, so you can watch that when you can. And then we go on to slide 16, which is descriptions of disease. The prognosis. This is, what the outcome is. Is the patient going to live? Are they going to survive, but maybe it's going to be chronic? That is considered the prognosis, the predicted course of the disease, or the predicted outcome of the disease. So it states the chances of complete recovery. It predicts the permanent loss of function and the probability of survival. So let's take something like influenza. The prognosis for influenza, as long as it's not like one of those weird strains, the outcome is pretty good. It's going to be an acute disease, nothing permanent or chronic. Usually there's not going to be any organ damage, and usually the patient makes a complete recovery. So that would be the prognosis for influenza or the common flu. Going on to the next one, again continuing with description of diseases. The course of a disease, I just mentioned these two, but there's 3 courses. We have acute, chronic, and we have terminal. Now acute means short-lived, but it's usually really severe in most cases. Some cases it may not be too severe, but acute means short-lived, and it is usually severe. Chronic is usually throughout a lifetime, or maybe not even a lifetime. It could just be throughout several years. So that's what chronic means. And then we have terminal, which means ending in death. So the patient will never get rid of it. So an example of acute disease, again, you have influenza, the common cold, measles. Chronic infections, we have arthritis, high blood pressure. And then terminal is going to be something like AIDS. AIDS will eventually lead in death. And then some cancers can lead to death, but we can't really, it has to be a pretty high stage before we can say that a cancer is terminal. So those are the 3 courses of the disease that you need to know. Okay, going on to the next slide, which is number 18, we have the stages of disease. Okay, we have remission, exacerbation, and relapse. Remission, this is when somebody has a chronic disease, and most of these are pretty much, when we're talking about the stages of disease, this is more of your chronic and terminal diseases rather than your acute. Remission, when somebody has, let's say, breast cancer, they can go in remission, their cancer cell may go down, signs and symptoms go down, so they're basically cured. Now, they may be permanently cured or it may come back, but that's considered a remission, like a little pause in the disease. An exacerbation happens, let's say, again, breast cancer. We have breast cancer, it goes in remission, then when it comes back, it's horrible, and it spreads to all body parts, lung and brain included. So that would be an exacerbation. And then a relapse returns like just within a couple of weeks or a month later. Let's say upper respiratory infection or a urinary tract infection. Those are some of the things that can have a relapse, most commonly because people don't take all of their antibiotics. So those are some of the things that can happen, and those are the stages of disease. Going on to the next slide, slide 19, the outcome of disease. We have outcomes, we have complications, a sequela, mortality, and morbidity. Those are the 4